Hopefully the others get it. I sent it to everybody in the who registered, and then we have a WhatsApp group, and I just added that there. Hello.
Hi, this is Soumya.
Glad that you're here.
Glad the meeting linking issue got sorted out. There was a meeting issue, so I'm glad that it got sorted out.
Yeah, now it's people joining.
Okay, I'll mute myself. Yeah.
Okay. Hey, Mary, glad you're in. Darnie's gonna join, hopefully. And let's see. We should have Jennifer, Malaika, Daranya, Pavitra, and Sandy as well too.
We'll wait just a few minutes for a few more people to jump on.
Okay.
Sometimes technology just doesn't agree with us.
Yeah, that happens. So
Hi.
hey, Darnie, glad you're in.
All right, well, we'll get started and then hopefully others will jump in as we get the Zoom all figured out. So thank you guys for joining. I am Kathleen Kilburg. I'm a pelvic floor physical therapist. I have been working with women of all ages. Probably my youngest patient is maybe 14 up until I had a 97-year-old woman. So everything in between. been working in pelvic health for the last 18 years, working on urinary incontinence, prenatal issues, postpartum issues, pelvic pain, bowel dysfunction, pretty much anything between the ribs and the thighs is our realm, and everything in between. So I just wanted to be able to talk to you guys a little bit about the pelvic floor. Generally, what I hear from a lot of women is when all of their issues started was after their first baby, and they're just too busy with this new life that you're taking care of to be able to take care of yourself. But this is when a lot of the things start. So just wanted to kind of do a little quick education, because so many people don't even know what their pelvic floor is made up of. So this is a top-down view looking at the pelvic floor. I do have my model too. So this would be if you were lying on your back. This is your tailbone down here and the pubic bone up here. You have these two different layers of the pelvic floor. So this is the urethra, this is the vaginal opening, and this would be the rectal opening. So you have this superficial layer of the pelvic floor that squeezes off the urethra. So when you laugh, when you cough, when you sneeze, you need this muscle to squeeze that area so that urine doesn't leak out at all. This deeper layer down here, if I tip it back a little bit, this is the layer that holds all your organs up in place so that you don't get a prolapse or feel that dropping down or the pressure. When you have a baby and they do an episiotomy, they cut right through here. So you can see there's, you know, all these muscles are intersecting here. So when they cut through all of these super, super important muscles. And when they sew them back together, they just kind of sew the hole closed. They don't really, you know, reattach this muscle here and this one here and this one here. So that's the reason that a lot of these issues start after a pregnancy, because the muscle either got stretched or torn or it got cut. So your pelvic floor has 4 main functions. One of them is support to help hold up all your organs and keep everything inside. One is sphincter. That's the little layer of muscle around the urethra and around the rectal opening that involuntarily stays closed so that you don't have to think about squeezing without leaking urine or stool. Stability, and maybe I can show on here a little bit. So the stability, it helps to hold your tailbone to your hip bones and helps to hold the pubic symphysis together. So provides stability to your whole pelvis. And then obviously the more fun one, the sexual function. The better the pelvic floor muscle contracts, the more blood flow that can get to the clitoris, the better enjoyable your sex can be, the better orgasm you can have, and the stronger orgasm you can have, because an orgasm is a maximal pelvic floor contraction. So those are its main functions. So there's a whole ton of things that can cause dysfunction of the pelvic floor. The biggest ones that we see are pregnancy and posture, honestly. So all of these other things can certainly cause issues to the pelvic floor. If you have gained weight, that extra pressure similar to a pregnancy, your posture, if you're not upright and your spine is stacked, there's a lot of downward pressure on the pelvis that can push the organs out and actually increase the laxity through the pelvic floor. Obviously, any sort of trauma, if you fell on the tailbone or anything like that. And then, of course, as we get older, things don't always function quite as well as they did when we were younger. As you approach and go through menopause, the pelvic floor muscles get thinner because of the loss of estrogen. So if you maybe didn't really work your pelvic floor or your core when you were younger, and then menopause hits and now you're having some leaking issues, it's because the muscle was just barely thick enough in the past to hold you together. And now that it's gotten thinner from the lack of estrogen, now there's not enough there to keep you stable. So all the things that can happen when you have dysfunction, and these are the things that I work with women. So all of these are super, super, super common. And they're things that women don't talk about that can happen after having babies. Pelvic organ prolapse is when any of the organs can be dropping down in the pelvis. They can't actually come all the way out the vagina. That's usually a more surgical issue. But we'll see women with all kinds of dropping. So your uterus can drop down, your bladder can drop down, the rectum can drop down. So any kind of pressure that you would feel vaginally, that may be a prolapse. Obviously, urinary incontinence is the biggest issue that women deal with pretty much from pregnancy on to end of life. It's a very, very, very common thing. Most women think it's just something that happens after you have babies and there's nothing that you can do about it, but there's tons that you can do about it. Constipation actually can often be a pelvic floor issue. If the muscles are tight and they can't relax around this rectal opening, then the stool can't come out easily, and then it gets backed up. And if it sits in your intestines too long, your body pulls more water out of it, and then the stool gets harder. Then when it starts to come out the next time, then it's even harder to get out, and it's just this vicious cycle. So we do work a lot with constipation with women. Obviously, any kind of pain. So pelvic pain, either with sitting or during exercise, pain with intercourse is super common. That starts after a vaginal delivery. And there's lots of things that we do to get back that enjoyable sexual function. Low back and hip pain, we see a lot with women who maybe have gone through physical therapy for chronic back pain or hip pain that usually started with their first pregnancy. And it just never got better, or it didn't get better enough. And that's because they kind of missed that pelvic floor component to it and need to either figure out if the muscles are tight and spasmy and they're constantly contracted, or if they're weak and not contracting at all. So what can you do to protect it? That's the best thing. So yes, obviously prevention is always the best course, but most of us don't think about our pelvic floor until after we've had babies or until after you have an issue. So even though this says how to protect your pelvic floor, all of this can also help to restore your pelvic floor. So if maybe you didn't protect it before you got pregnant, you can do all this stuff to restore it and get it healthy again. So it's so much more than just Kegels. You really need to strengthen your entire core. So your core you can think of as like a box. The top of your box is your diaphragm. The bottom of the box is your pelvic floor. The front is your transverse abdominal, and the back is this teeny little muscle called your multifidus that goes from one vertebrae to the next. So you need all four of those working together in conjunction while you're exercise, while you're holding your baby, while you're bending down to pick up the laundry basket. All four of those need to work together to protect your whole pelvis and your spine and your organs. So I do teach Kegels to women, but that's such a small part of it. It's getting those Kegels working with everything else. The other thing that we spend so much time on is breathing techniques. And I know it seems so silly, but I spend half my day teaching people how to breathe. I always tell everyone, if everybody knew how to breathe properly and had a strong core, I wouldn't have a job as a physical therapist, because that is 90% of it. If you can really strengthen your core, your back will be healthy, your hip will be healthy, your pelvis will be healthy, and then above that and below that, so all the way up to your neck, down to your ankles, all of that will have stability if your core is stable. So it's so super important. So we really work on teaching that belly breath. So everybody try and take a deep breath, put one hand up on your sternum and one hand on your belly, and take a deep breath in and then exhale. And as you took that breath in, which hand would rise first? Was it your sternum hand or your belly hand? And if it's your sternum hand that rises first, then you're not breathing correctly. You really need to get that belly hand to breathe. And so sometimes you need to spend a few minutes every day working on getting the lower part of your ribs to expand out and forward, instead of just all this upper chest breathing that we do when we're busy, when we're stressed, just these short little breaths. So that's something that I work a ton on with women. And then just body mechanics, just knowing, you know, how to bend down to pick up the car seat carrier. You know, you shouldn't bend at your back, you should bend at your hips. Those are some things that a lot of us know. We don't necessarily always do it because we're busy, but working on getting those mechanics is really important. And then if you are pregnant, making sure that you prepare properly for delivery. You know, you get your pelvic floor strong, you wear a support belt. Some of the ones that I usually recommend for women, if you're just needing some stability support, is called the Stork Sport. If you have a diastasis recti where your abdominal muscles are separating, then we usually recommend something called the Better Binder. So just having some outside stability support to help to protect you as your belly gets bigger and bigger. And then we have all kinds of alternative birthing positions that we can recommend based on whatever your particular issue might be. Most of those only really work if you're not getting an epidural. If you get an epidural, you know, everything is numb from the waist down, so you pretty much have to lay flat on your back. And then obviously, if you have a pelvic floor issue, the quicker you get treatment, the better. So Kegels are great, but they're not the be all end all of fixing any pelvic floor issue. So all of these are my favorite exercises that I give to all of my women to strengthen your pelvic floor. Like I said, I may have some people do Kegels as part of it, but once they learn to contract their pelvic floor and their abdominal and their breathing, then you're not just sitting around doing Kegels anymore. You're activating your pelvic floor while you do these other exercises. So if you're somebody who works out, these should be in your program, absolutely. The biggest ones that every single one of my patients does is squats, clams, and bridges. If you do nothing else, make sure you do those three correctly. And you can add all kinds of extra resistance to them. You can add a ball between your knees for squats and bridges. You can add the resistance band around your knees for all three of those to add extra resistance to the exercise to even more strengthen your core. But those are three that you should be doing every day to strengthen your core and your pelvic floor and to just protect all of that. All these other ones are great as well. If you're really into working out, this can be a full workout. If you did all of these 3 times a week, you would have a great butt and you would have a good core. But if you do nothing else, squats, clams, and bridges every day with good breathing and good muscle activation, and you'll be good. So if you have some issues, when do you need to see somebody? So this is something that I do a ton of education for women on, because again, it's something that people don't talk about. You just have these babies, you go home with these new lives, and the doctors say at 6 weeks, like, okay, you're good to go. You can do whatever you want. And they don't tell you about any of the things that you may be experiencing that really aren't normal. So any pain at the scar site, whether that is your C-section scar or perineal scar, there shouldn't be any pain past the healing point. You know, once you get past that 6 to 8 weeks, when it's healed, it should not be painful to touch. Any bladder issues, any urgency, meaning once you get the urge to go to the bathroom, you need to run there. You shouldn't have to do that. You should be able to calmly go there. Frequency, you should be able to hold it for 3 to 4 hours, and you should not be waking up during the night unless there's a little person waking you up. And then obviously leaking. You should not be leaking no matter what. You should be able to cough, sneeze, laugh, run, jump on the trampoline, all of it without leaking. And then some of these other ones are probably more ones that you would seek help for. You know, if you had any fecal incontinence, most people will seek treatment for that. Pain with intercourse, like I said, that's pretty common that starts after pregnancy. I do see a lot of women who say it's always been uncomfortable even before pregnancy. So then there usually was probably some muscle dysfunction to start with for them. And then any heaviness in the pelvis that may be indicative of a prolapse. So you want to get that checked just to see if there is some dropping down. And there's tons of things that we can do to help support that. And then any pain anywhere in the tailbone, the hip, the back, anywhere in the pelvis, you know, definitely see a PT and have that assessed. And then the diastasis recti abdominis, it's something that's so common, and I really don't know any OBs who routinely check for it. Some of the midwives do, but most of the OBs just really don't routinely check at your 6-week appointment. If you think you might have one, you can lay down flat on your back and just put your hand in your belly button, kind of going across. So if this is your belly button, your hand is this way. And then laying flat on your back, just lift your head and shoulders up. And most of us after pregnancy, there'll be a little bit of a space there in your belly button. You want to see how many fingers you can fit into that space. If this is the space in your belly button and you can only fit 1 finger in there when you lift your head up, then you're good. If you can get 2 or 3 fingers in there, then you have a diastasis. And then that's the front part of your container is open. So even if your back muscle and your pelvic floor and your diaphragm is good, the front of your container is wide open. So you need to work on the transverse abdominal to get the front of your container to close back down. And I see women, you know, babies are 10, 12 years old, you can still close that diastasis. So it's never too late to get it to close back together. So if you feel like you have some of these issues and you want some more help, you don't want to just kind of keep trucking along, or you want to have more babies and you don't want to cause more damage to anywhere in your core, there's people out there to help you. There's pelvic floor PTs that you can go see. And then we are all pelvic floor PTs, all at the Bladder Coach, but we do virtual coaching. So we would meet you via Zoom like this. There's no exam. You're not taking your clothes off in front of the camera or anything. Just based on your symptoms, we kind of know what's going on. So we have specific exercises that we guide you through to work on any of those issues that you might be having. And it's a one-on-one program specifically geared towards your specific issues and your goals. We do have some self-paced programs that you would just get as a package, and then you follow along with it as you progress on your own. But we do have options. And then I do also have a network of pelvic floor PTs. So if you have some issues that are a little bit more advanced than what virtual coaching might be, and you feel like you need to see somebody, I go into my network and I look to try and find somebody close to you that we can get you connected with for pelvic floor physical therapy so that you can get stronger and get back to doing whatever it is you want to do. So I know we went through that kind of quick. I wanted to be respectful of your time since we got started a little bit late. But this is all my contact info. If you're not on your phone, you can scan the QR code. That'll take you to it. But Connie will send out all the info as well. But hi. If anybody has any questions, you can put them in the chat. If you don't want to ask it out loud, or you can just type in the chat anything. You can also write my email down if you just want to send a private email because you either don't want to ask in front or you didn't think about it until afterwards. You can always just shoot me an email if you have any questions about anything. Anybody have anything that they want to put up or ask right now?
Yeah.
Hi, Kathleen. Oh, who's that?
You can go ahead. Yeah.
Oh, okay. Hi, this is Mary. Thank you for that first presentation. That was really great, especially the diagram of the pelvic floor. So I actually have been to a pelvic floor therapist locally. And for the ladies who don't know, there's actually one at is it called PAM for PAMF in Fremont. And it was, it was pretty high tech. Like, of course, it was, one-to-one. So it was, somewhat invasive. They, they stick a finger in your vagina and then they use a biofeedback machine. That's just how they measure like how much your muscles are contracting. And I think I did about 4 sessions of that. But I kind of just gave up on the Kegels. Like I don't know what it was. I just found it so hard to have like the intention to do them every day.
Yeah.
And I was wondering how common that was. And then I was also wondering, where does like physical surgery fit into all this? Because I know there's something called I think it's called sling surgery. There's several kinds of surgery for incontinence. And they recommend that you do it once you've had, obviously all the babies you're going to have in your life.
Yeah.
And I'm just wondering what you think of surgery, like when is that appropriate?
Yeah, so the first part about the Kegels is, it gets super boring. People say do your Kegels when you're sitting at the stoplight. And it doesn't happen. That's why I like to integrate it with your other exercises. So whatever you like to do, if you like to do boot camp stuff, then I teach you how to activate your whole core, not just the pelvic floor, while you do those boot camp exercises. If you like to lift heavy weights, then we work on how to activate while you're doing the heavy weights. I really only do Kegels in the very beginning, just so you can learn how to contract it. You're not doing Kegels all day long because nobody does that. And the sling surgery, so that's for a bladder prolapse. And they are successful if you have a grade 3 or a grade 4 prolapse. But the surgery only fixes the connective tissue. It doesn't do anything to the muscle. So if you're still bearing down, if you're still holding your breath, you're going to blow out the surgery. So most surgeons, at least that I work with, want you to do PT either before or after surgery so that you learn how to activate those muscles and how to correct your breathing patterns so you don't blow out the surgery. But yes, you have to wait till you're done with babies.
Okay, thanks.
Sure. Anyone else have any questions?
Yeah. Hi, Kathleen. This is Soumya. I really liked your presentation and the education that you gave and the introduction about all the symptoms that we should look for. You mentioned one symptom, which was we shouldn't be going to pee in the night. I've always gone once in the night, even before children or after children. Are you saying we should never have to go until we are like old or anything like that?
Yeah, once you're past menopause, then the average is to get up once per night. And some of that is because the way your kidneys function as you get older and the tissue thinning. But prior to menopause, you really should not have to get up during the night at all. So if you do, then we kind of look at, are you emptying your bladder completely? Even just some bladder habits. Are you drinking all your water in the evening? And so that's why you're getting up. So we work a lot on behavior modification, but unless there's somebody grabbing at your hair to wake you up during the night, you really shouldn't have to get up to go to the bathroom.
Okay. Interesting. Okay. Thank you.
Yeah.
Thank you.
Can I ask a related question to that about getting up at night? So you said, something about drinking a lot at night, and I definitely do that. So are you saying that like people shouldn't drink anything for like 2 or 3 hours before bedtime?
No. You should still drink, but we usually say to limit it the last 3 hours before bed. So if you're getting 60 ounces throughout the day, you shouldn't be getting 30 or 40 of that in the last 3 hours of the day. But, certainly 10, 12 ounces in those last 3 hours is fine.
Okay, thank you, Kathleen.
Yes. Anybody else have anything?
Kathleen, you mentioned in the beginning that one may have pelvic floor dysfunction due to lack of estrogen. So are there foods that could help? Like if we were to eat
there are some foods that are estrogenic. So it means it helps your body to convert to estrogen. It's not necessarily a supplement. So, once you're postmenopausal, that may not be enough to really build your estrogen base. But it can help to supplement it a little bit more naturally if you don't want to do synthetic hormones. So there are some estrogenic foods, a lot of the green leafy vegetables, lentils, things like that.
I have another question. So I've noticed in the marketplace that there seem to be more incontinence products.
Yeah.
And I'm wondering if that is related not only to women having babies, but general obesity and lack of exercise in society.
I mean, so some of it is just more a awareness. So we're just talking about these things more. But yes, as our society as a whole gets larger and heavier, that puts pressure on the bladder. So that's definitely probably part of it. Awesome. Well, thank you guys so much for spending your evening with me. This was great. And like I said, write down my email address. If you have a question that comes up, feel free to just shoot me an email. And I'm all about educating and just letting women know that, there are better ways to take care of our bodies.
Thank you, Kathleen.
Kathleen.
All right. Thanks, guys.
Thank
Good
you.
night.
Thank you.
Great.
Thank you. Good night. Thank you, Connie. Thank you,
Bye.
Kathleen.
Thanks.
you.
Bye-bye.
Thanks for organizing that, Connie.